gives me great pleasure again to welcome Ines to our gathering this evening.
Ko te tiriti, ko te tiriti, te tiriti o Waitangi. Ko te tiriti, ko te tiriti, te tiriti o Aotearoa. Hiki te kirunga, hiki te kirunga, motu hake, rangatira tanga tuku iho, rangatira tanga tuku iho.
Tēnā koutou, tēnā koutou, tēnā koutou katoa. Ke te mihi ahau ki a koutou a Ngāpuhi. Kia ora Chris mō tō mihi. Kia ora Ngāri Rei. Kia ora Whaiahane. Kia ora tō koutou rangatira o te turi moana. He honere nui ki te kōrero i tēnei hui. Nā tā tātou roro kia ora nā tamariki. Thank you very much for inviting me to speak, and thank you, Chris, for your introduction, Nairi for organising everything, and your fabulous leadership here too, Whaiahane, Moana for your great leadership in the area of law, and with our small baskets we can keep the children well. E hara taku toa e te toa takitahi e nari e toa takimano e, and I'd particularly like to acknowledge the Child Poverty Action Group's website there if you don't already know it, and also the Paediatric Society of New Zealand, whose slogan is health of our children, wealth of our nation. So we know that we are the best in the world at rugby. We are the best in the world, and every New Zealander got behind that. We put all the resources we wanted to. We committed everything as a nation and as rugby people to be the best in the world. And that's our ranking statistics out of 25 countries. These are our rankings this is our ranking for health. New Zealand children's health and safety compared to other OECD countries. And you'll see here we're 24th out of 25th, not first out of 25th as we are for rugby. So what would it take for us to become first out of 25 as we are for rugby? In this lecture, I'm going to talk about child rights, and I think you'll be pleased because that was what was advertised. Child health outcomes in New Zealand, international comparisons and inequalities within New Zealand, determinants of health, a triple jeopardy, and briefly the way forward. So in the New Zealand context, we have four documents and conventions in which we can frame our child rights and we should look to for direction. And the first I want to talk about is the United Nations Convention on the Rights of the Child. And this convention was formed in 1990 and New Zealand ratified it in 1993. And this convention is, while quite lengthy, in essence, these bullet points summarise the relevance to health. That children have the right to an adequate standard of living, the right to a free education, rights to shelter, health, medical services and measures to prevent illnesses, the right to appropriate care for mental and physically disabled children, and that governments have responsibility to ensure these rights. So that being the case nearly 20 years ago, how are we doing? Well, the United Nations Committee on Children gets reports from governments and non-government organisations in New Zealand to monitor what we're doing. And in February, just a year ago, they reported on our progress, and compared to the last report in 2003, they said the positive developments were the amendment to Section 59 of the Crimes Act 1961, not using reasonable force to discipline children, increasing expenditure on children, policies to support families and address family violence, abuse and neglect, and a number of legislative initiatives and ratified international instruments. So this looks quite a good picture, and it is good that some areas have improved. But then they went on to say there were serious concerns about New Zealand where progress had been minimal. The disparities experienced by Māori children and children in poverty and vulnerable situations, these were their concerns about the lack of progress in addressing their previous recommendations, both as a general point and reiterated throughout the specific areas covered, such as child labour, juvenile justice, adoption and policy coordination. And they were concerned about the failure of the government to remove its reservations and harmonise its domestic laws with the United Nations Convention. And they remained alarmed at the high prevalence of abuse and neglect of children in the family. So that's where we are with the United Nations Convention on the Rights of the Child in New Zealand. We have a Human Rights Act 1993, which in essence states that everyone has the right to freedom from discrimination. Well, we had a major onset of discrimination against children in New Zealand in 1996. And this was the introduction of the child tax credit by the national government in that year. And Annette King at the time, in opposition, stated, sorry, before I go on to read this through, the child tax credit was giving money, a tax credit to parents who are in work, but not giving it to parents if they weren't in paid work. And she said correctly that what this national government has done is create two classes of children, the children of beneficiaries and the children of people in work. We've never before had a public policy that labels children and puts value on a child whose parents have a job and a lesser value on a child of a person who's on a benefit. But that is exactly what this national government has done with its announcement. If one is the child of a beneficiary, one is not as valuable as the child of a working person. I would just go on to say that Labor have not reversed this. In fact, they've cemented this as the in-work tax credit, as it's now been renamed, somewhat misleadingly, but it's because it's a child tax credit if the parents are in work. And it's worth $60 a week, which you'll know how important that is to families who are struggling. But it only goes to families where a single parent is in paid work 20 or more hours per week, or two parents work 30 or more hours per week between them. So you can see there the single parents also at disadvantage compared to the two parents, and if they work 19 hours, they won't get it. This discriminates against children of parents on a benefit as they're not eligible. It was intended to lift some beneficiaries into work, but this has failed as a policy. So the Child Poverty Action Group, in recognising this discrimination, laid a legal complaint with the Human Rights Commission in 2002, and after a lot of convoluted legal processes tried to stop us to take the case. And finally it was heard by the Human Rights Tribunal in 2008, and they found that this in-works tax credit, as it's now called, constitutes real and substantive discrimination against children. And but they then went on to say that this discrimination is justified. So the Child Poverty Action Group wasn't going to take that last point lying down. So we went to the High Court, but they agreed with the findings of the Human Rights Tribunal. So we're now taking this to the Court of Appeal, and we'll go to the Supreme Court if we need to. So if anyone wants to find out more about that, go to the Child Poverty Action Group's site. But this is an example of discrimination against children that began in 1996 in this country. Again, it was discrimination against the poorest children. We have, as another background rights document, the Declaration on the Rights of Indigenous People 2007, which was endorsed by New Zealand in April 2010, and you can read that there. But of course our most important piece of legislation in regard to Indigenous people is the treaty, which in regard to health was to give an equal opportunity for health for New Zealand children, Māori and non-Māori. So how are we faring in this regard? Well, I'd just like to start with, you probably heard this last year from Anne Salmon, because I'm quoting her now, but let's just think for a moment about what was Māori health like before the Europeans arrived, or as they arrived. They had excellent health and freedom from child abuse at that time. To both Cook and Banks, these people, Māori people, were healthy in the highest degree. I think we have to say that's excellent. Compared with Europe of the time, children were rarely hit, meaning two things. They weren't hit in Māori, but they were hit in the European context. The women seemed to be good mothers, the men were also very fond and kind to their children. And I've heard Anne speak since she wrote this book, and she said every single thing she's ever all the evidence points to these being true facts. Contrast this then with the compilation by Paparangi Reid and Bridget Robson in 2007 talking about Māori health at this time. There are consistent, comprehensive and compelling disparities in health outcomes and exposure to the determinants of health. Despite the strength of these long-standing health inequalities, they do not create dismay, disbelief or horror. They've become expected. This acceptance and normalisation of inequalities provides an excuse for government inaction. I have a personal connection with Tūhoi from having worked with them in 1977 and having been through my great-grandfather having a connection with the Presbyterian mission at Mongopohatu. So I'm just going to give a couple more examples around child well-being in regard to Tūhoi. And we are inspired by Judith Binney's wonderful book, which if any of you are interested at all in Indigenous people anywhere in the world, not only in New Zealand, it's a wonderful exemplar of the effects of colonisation and the uphill struggle against it and the consequences of it, and yet a very and showing the strength and resilience of Māori people. So, from her work, we know that in January 1866, there was this large tracts of land here were confiscated by the Crown illegally, and this land that was taken was the best agricultural land, 14,000 acres, and most of the land behind the confiscation, was this area here, was unsuitable for farming, being inland hills, valleys and gorges. And this is Mongopohatu I referred to, and I'm going to mention Te Whāiti in the next slide. So the Tūhoi were forced away from their arable lands, they were stolen off them and had to move back here, and this resulted in a series of famines. And there were a lot of deaths in the famines, and the children being the most vulnerable. This is just from Judith Binney's book about a famine in 1897 at Te Whāiti, I showed you on the map. Tutu Kangahau, a Tūhoi chief whose 7-year-old granddaughter died of measles at Te Whāiti, cried out during the procession to bring her home to Mongopohatu. This dying of our young people is a new thing. In former times our people scarcely knew disease. They died on the battlefield or of old age.